Hello everyone, 大家好. Today we're going to talk about itchy skin and dryness syndrome. Today's talk is going to be the second last talk of my Chinese medicine, and also is second last talk before the end of this year, before Christmas. Okay, now let's go to the slide and then go to the content. We're going to talk about itchy skin. Itchy skin is quite commonly seen. I've seen in my friends, in my family members, especially old people. But as a Chinese medicine practitioner, I haven't seen many come to see me just for itchy skin or dry skin. So I assume there are a lot of other easier and more convenient solutions in the Western world, in the society. So the people don't normally come to the Chinese medicine to search solutions or treatment for the itchy skin. The wind is the pathogen of itchy skin. It includes internal and external wind. We mentioned about wind in our Chinese medicine, dermatology, diagnose, pathogenesis talk. There's often no rashes in the dry skin condition. The itching can start at one place and then spread to all over the body. It's the nature of wind. The wind doesn't produce rashes, but it produces itchiness. It travels and move fast. Some patients have other illness like diabetes, hyperthyroid, anemia, and so on. Now let's go to different types of itchy skin. In the reality, it's not itchy, just itchy skin. There are different types as well. The first type is wind heat type. It often happens in summer. The whole body is itchy, especially after sweating. There are many scratching marks. Scratching marks is an indication of itchiness. The patient also has poor appetite, restless, insomnia, red tongue with thin coating, and a rapid pulse. The treatment principle is dispel wind, clear heat, stop itching. The formula we use is famous 消风散. In dermatology, 消风散 is very famous. It's a very commonly used formula for itchiness, for a lot of other skin conditions. This is a famous formula to modify, to be used for modify. If there's summer heat, we add Hua Cao, which mainly produce urine to give the heat a way to go out. For the young people, we can add blood cooling herbs, cool the blood. It's internal heat. For thirst, we can add Mai Dong Yu Zhu. Now, the second type is wind cold type. It is more often in winter. Patient often has yang deficiency. The patient can feel itching when encounter to wind and cold. For example, taking off clothes or put on clothes in the morning when you get up. The room is really cold, and then this time you can start to have itchiness in the skin. The itchiness is relieved after entering a warm environment, or if you turn on the heater in the room, it won't happen in the early morning. The patient has pale tongue, thin white coating, superficial and tight or superficial slow pulse. The formula we use is 桂枝麻黄汤. In some countries, ma huang is not allowed to use. For example, Australia is not allowed to use ma huang tang, but we can modify this. In China, you can continuously use ma huang. It's only 3 grams in the formula. We modify this formula following patient's condition. 桂枝麻黄汤 is in Zhang Zhongjing's Shanghai Lun. It's famous for some exterior conditions, wind cold attack conditions. Now, the third type is blood deficiency type. The patient has long-term illness and is weak. The whole body is itchy, like there are insects crawling. It is more severe at night. The patient feels tired, dizzy, palpitation, sleepless, poor appetite, and pale. The tongue is pale with thin coating. The pulse is deep and thin. The treatment principle is nourish blood, moisten dryness, expel wind, stop itching. The formula we use is 养血消风散, means nourish blood and dispel wind formula. We modify this formula according to patient's condition. And this formula is originally come from other formula. But the main purpose for this formula is nourish blood. You can see they are very strong blood nourishing herbs, and dispel wind. There is quite strong wind dispel herbs as well. Now, the third type is blood stasis type. This kind of itchy skin patient has long history. The itching is more at pressed area of the body, like under the belt, under the bra. There are many dark purple scratch marks. The patient has withered face, dark lips, dry mouth, but not wanting to drink. It's different from the heat type. The patient with wind heat, they normally feel very thirsty and want to drink, but this one doesn't want to drink. The tongue is dark with purple spots and a little coating. The pulse is deep and choppy. The treatment principle is invigorate blood, unblock the meridian, dispel the wind, and stop itching. The formula we use is 活血止痒汤. It means blood invigorating and nourishing decoction. 活血滋养汤. Sorry, my pronunciation was wrong. So the ingredients are here mainly. We mainly use invigorating herbs and nourishing herbs. We can also use acupuncture for the dry skin condition. We can use every day. We can use every 2 days, every 3 days, according to patient's condition and whether they can afford of treatment or not. There are some root points, wind heat points, wind cold points, blood nourishing points, and the kidney and the liver points for deficiency points. You use this as a reference. You don't have to exactly just use these few points. You can add points or modify the points according to your diagnosis and the patient's condition. Now, for external treatment, because there are many kinds of itching relieving products nowadays in our pharmacy, so I won't mixing herbal products. It's more expensive, first of all. Secondly, patient probably already is using some itching relieving creams, oil, and they found is helpful. That is for itchy skin. I've talked about 4 different types and 4 different formulas to modify and acupuncture. Now we go to the next one, dryness syndrome. I tried to find in Western medicine, only found the Sjogren syndrome can match with dryness syndrome in Chinese medicine. I'll briefly talk about Sjogren syndrome at the end, but we focus on Chinese medicine theory and treatment for the dryness syndrome. Dryness syndrome is often seen in old ladies. Actually, I've seen quite a few, but in the society, old people, sometimes they don't come to the Chinese medicine practitioner, look for help for their dry skin, dry eyes, dry mouth. They buy some drops from pharmacy, put into their eyes, and they buy some cream, put on their skin, and they drink a lot of water to solve the problem. But if you do have chance to see some patient, you can use Chinese herbs to treat them. Chinese medicine explain dryness syndrome in two ways. One way is the body fluid cannot be disturbed. Another explanation is the body fluid has been damaged. So the dryness is the pathogen. But why people have this dryness? There are two different kinds of reasons. Normally, in our body, we drink water, or we get water from outside in different kind of format. Maybe you have ice cream, you have ice blocks. They all turn to the water, go to your stomach, and then go to spleen. Spleen has transformation function, transfer to the lung and kidney. These are the two organs in charge of looking after the skin, distribute the body fluid to the whole body. Of course, spleen transfer the body fluid to other organs as well. If lung and kidney and spleen have problems, and then it will affect this transformation, transportation, dispersing function, and then will have cause body fluid distribution problem, and then directly affect skin condition. For example, if these three organs have qi deficiency, and then there's no energy to transport body fluid to different parts of body. Lung in charge of skin, kidney in charge of the root of all the organs, and also the water metabolism. So this will cause the dry skin, dry eyes, dry hair, dry memory. The hair is in charge by the kidney. So you'll see all these places are dry, and the jingye, another condition is jingye can be damaged due to yin deficiency, due to internal heat, due to fire. So yin deficiency often have produced deficient heat. There are some other conditions we have strong internal heat or fire, and can damage body fluid, produce dryness syndrome. Recently, research found 50% of dryness syndrome patients can also have rheumatoid arthritis and lupus. So this probably is another match with Sjogren syndrome, type 2 Sjogren syndrome. Now let's look at the patterns and treatment for dryness syndrome. The first type is spleen and lung qi deficiency type. The patient has dry mouth, lips, and nose. Skin is dry with some scaling. The hair is dry, thin, and also easily breaks and falls off. Patient has pale face, poor appetite, lethargy, constipation, and harsh voice due to dryness. The tongue is pale with thin white coating. The pulse is weak. I've seen one of these patients. This harsh voice, sounds like she had a long history of smoking, but not really. She doesn't smoke, but the voice sounds like that. The treatment take a long time to start to have effect. So I warn you, use strong herbs to use high dosage to start with to bring the result quicker. The treatment principle is tonify spleen, nourish lung, and moisten the dryness. We use 补中益气汤. The 补中益气汤 is a very famous qi tonified formula. And this type is mainly due to qi deficiency. So we modify 补中益气汤 and then add some other herbs for relevant conditions for relevant diagnosis. Now, next type is qi and yin deficiency. So not only qi, yin is deficient due to various reasons. Patient has dry eyes, dry mouth, lips, throat, skin, and no tears and no sweating either. The hair is dry and easily breaks and falls off. There's joint pain, back and knee discomfort, dizziness, lethargy, ringing in the ears, and poor hearing. The tongue is red, no or little coating. The pulse is deep and thin. We can see this is more severe and more complicated condition than just the qi deficiency. Our treatment principle is nourish qi and yin, moisten dryness. We use 大补元间. This is also a very famous formula. I believe you have learned this in your formula part of our Chinese medicine course. We modify 大补元间 if the patient have very strong dry eyes, we add 菊花. If the person has strong dry mouth, we add 生地黄, 五味子. For the painful joints, we add 桑寄生, 威灵仙. These are the two herbs for arthritis. Now let's look at the third type, lung and the stomach dry heat. Patient has dry mouth, little and sticky saliva, red tongue with little cracks, dry nose, dry skin, dry hair, red face, thirst and wanting to drink. You see, when you have heat, patient wanting to drink. Smelly mouth, swollen gums, dry stool and yellow urine. The tongue is red and dry, the pulse is fast. The treatment principle is clear the lung heat, moisten dryness, cool stomach, nourish yin. We can see lung and stomach type is slightly different from last two types. So the symptoms actually appears following the which organs affected. The formula we use to modify is 桑杏汤 and 益味汤. 益味汤 you may not learn in your formula course, but 桑杏汤 I'm pretty sure you have learned it. So these two formulas are used to treat the lung and stomach dry heat. Now, next type is yin deficiency type. Patient has dry eyes, no tears, blurred vision, dry mouth and lips, dry memory in genital area, dry skin and hair, painful joints, weak legs, discomfort back, heat in sole and palm, skinny body shape with red face and eyes, and a dry stool. The tongue is dry red with no coating. The pulse is deep and thin. Our treatment principle is nourish yin, clear heat, produce jing, moisten dryness. The formula we use is 六味地黄汤 plus 一贯煎. These two formulas are famous yin-tonified formulas. I'm very sure you have learned these two formulas in your formula course. And in deficiency, although the symptom can be strong, but because the reason is only one reason, so the treatment is kind of simpler, easier. You just add very strong in-tonified herbs like sheng di huang 30 grams, shu di huang 30 grams, and then try to bring a good result. So our dryness syndrome is finished here. Now I just quickly go through this Sjogren syndrome. Sjogren syndrome is an autoimmune disease. Autoimmune disease normally is caused by body produce abnormal extra antibodies in the blood against our own body. It's called autoimmune disease. For Sjogren syndrome, it produces extra antibody against our tissue, different tissue in the body. The particular character is it produces inflammation in certain glands of the body. For Sjogren syndrome, it's mainly produce inflammation in the saliva glands, the parotid glands lead to dry mouth and dry lips, and also the eye tear producing glands, which cause dry eyes, and the saliva producing glands, which cause dry mouths. And also this dryness, 3-area dryness, is not connected to any other tissue diseases. So, and then we call it primary Sjogren syndrome. Now, I also got some photos from the website. Now, this is only one photo from website. It shows the 3 areas the Sjogren syndrome is affected. Sometimes we remember picture longer or better than the words. So dry eyes, dry tongue, dry saliva, because saliva gland is affected. Okay. Now there's another type of Sjogren syndrome, type 2. It is associated with connective tissue disease, such as rheumatoid arthritis, systematic lupus, erythematosus, or scleroderma. This is the type 2. The exact cause of Sjogren syndrome is not known. The research found maybe it's related to the inherited factors, genetic factors. It affects 4 to 7 per thousand in the population, or 3 to 4% in the senior population. And it mostly affects females. If you ask the ladies over 80, 85, maybe you see a lot of them using eye drops to moisten their dry eyes, and they complain they feel thirst a lot. So it's not rare. Okay, now today's itchy skin and dryness syndrome talk is finished. As I said, this is my second last of dermatology talk. I'll see you in my next talk. It will be my last. I'll finish my Chinese medicine dermatology talk. Okay, thanks for listening. I'll see you next time. Thanks. 再见。